Patient assessment, management, medical. Takes or verbalizes the appropriate PPE precautions. Determines the scene situation is safe. The scene is safe. Determines mechanism of entry, nature of illness.
Hey, hon, what's going on today?
I'm having the worst headache of my life.
Did it come on really sudden or kind of gradual? Really sudden?
Yeah.
Okay.
Determines the number of patients.
I have one patient.
Requests additional EMS assistance if necessary.
Yes, let's get ALS on the way right now.
Okay.
Consider stabilization of spine.
Did you fall or anything?
Mm-mm.
Any neck or back pain?
No.
Okay, so no C-spine.
Verbalizes general impression of the patient.
This patient is very sick.
Determines responsiveness, level of consciousness.
Do you know where you are?
Kind of like
Okay, do you know who the present is? Do you know what day it is?
the 14th.
Okay, so she's alert and oriented by 3.
Determines chief complaint, apparent life threats.
Okay, I know you have a really bad sudden headache. Any other complaints at all?
No.
Okay, so chief complaint is her headache.
Assesses airway and breathing. Assessment. Initiates appropriate oxygen therapy. Assures adequate ventilation.
Okay, so she's sat in at 99, which is good, so I don't need oxygen. Her
Straighten your arm.
her airway is open and patent. She's talking to me in full sentences. I don't see any difficulty breathing, so airway is good.
Assess circulation. Assesses, controls major bleeding. Checks pulse. Assesses skin.
Okay, she got a really strong pulse. Skin is pink, warm, and dry. I don't see any bleeding. Are you bleeding anywhere, ma'am?
No.
Okay.
Identifies patient priority and makes treatment transport decision.
This patient is high priority. Let's get rendezvous with ALS.
OPQRST.
All right, what were you doing before you got this really bad headache?
I was playing soccer.
Okay, anything make it better or worse?
No.
Okay, is it bleeding anywhere? Going down your arms? Anywhere? Okay, 1 being a little bit of pain, 10 being the worst pain of your life. 10. Okay, and how long have you had this headache?
Like 10 minutes.
10 minutes. Okay. Okay.
Sample history.
All right. So besides your headache, any other problems going on now?
Mm-mm.
Any allergies?
No.
Any medications?
Uh-uh.
Do you have any past medical history? Like, has this happened before to you?
No.
Okay. When was the last time you ate?
Like an hour ago.
Okay, so like before soccer?
Yeah.
All right. And then you said you were playing soccer right before you got the headache.
Mm-hmm.
Okay.
Secondary assessment. Affected body part system. Cardiovascular, pulmonary, neurological, musculoskeletal, integumentary, GI, GU, reproductive, psychological, social.
All right. Can you go ahead and try to look at my forehead, okay? I know it's hard to look right now. Okay. Pupils are equal, normal in size.
Vital signs.
Your blood pressure is 126/80. You got a pulse rate of 92, and your SpO2 is 98%. Lungs are clear and equal bilateral. Breathing about 14 breaths per minute.
Okay.
States field impression of patient.
This patient has possible aneurysm.
Interventions.
Let's rendezvous with ALS as quickly as possible.
Yep.
Demonstrates how and when to reassess the patient to determine changes in condition.
I'm going to reassess her every 5 minutes along the way.
Sounds good.
Provides accurate verbal report to arriving EMS unit or receiving facility.
All right, so to ALS, I'm going to tell them we got a 15-year-old patient here with a sudden headache that's super severe, worst headache of her life. 10 out of 10 pain, nothing make it better or worse. Her stats are 98 with a pulse of 66, blood pressure was normal, and we transfer her in position of comfort.